Johanna. So I work with Ren Hospice as well.
And Ren Hospice is where?
Right here in Anderson.
In Anderson. Wonderful. Pardon me, we have so many hospitals.
We have
That's okay.
many. That's okay. We will forgive you on this one.
Yes, yes. And Mr. Neff's primary care doctor, it used to be, I'm trying to remember,
Hank.
Dr. Hank? Is it
Yes.
still Dr. Hank?
No,
No.
Dr. Frank.
Dr. Frank. I
Okay.
believe he's worked in this facility before too.
Yes, yes, he was one of the residents here, I think, right?
I believe so.
He was a resident.
Yeah.
Yes, yes. Wonderful. And where is he practicing now?
Out of Greenville.
Out of Greenville.
He
Okay.
works through like a doctor's making house calls company.
Dr.
Wonderful.
Frank, are you on? Yeah, I'm gonna put you on speaker. This is Dr. Frank on the phone, if everybody wants to know. He wants to hear the,
Good afternoon. This is Zafar Hussain. We've met before, haven't we?
Yes, we have.
Good afternoon. Good morning, rather. I'm just waiting on Dr.
Yeah.
Malik to come in here because he just was in the middle of a procedure, and now you two are both sons, right?
right.
Correct.
And are you guys daughter-in-laws?
That's my
Daughter-in-laws.
wife.
That's what I thought.
That's
And I
his
know
wife.
who you guys are. And while I'm waiting for Dr. Malik to come, what is your understanding? I'm just so that we can all level set, I think. What is your understanding of what's going on here?
Vicky.
I don't know about anybody else, but I'm under the understanding that there's been no change in the lungs, and that he's on a high flow oxygen level, extremely high, and that's where the confusion is like his wish is to go home, and we want him to have his wish, but at the same time we don't want him to be suffocated. We want him to go peacefully. And so Ren is here because they would be taking over the care, and we don't understand what that transition, if it gets to that stage to where we have to, that he demands that. But the last time he was reported, he wanted a couple more months, which, so that was what I
But
you know, but
he wanted a couple more months at home.
at home.
Right.
And so,
Yeah.
what does that look like, and how does that happen?
Right.
When I'm not understanding the difference in the oxygen and what that's gonna do to him.
Oh, okay. So again, I am Dr. Hussain, and I was asked to come today by Dr. Malik. He requested something called a supportive care consult, and the supportive care team we're a bunch of folks that help in making some decisions with families when we get to complicated situations. Hospice is one form of that, and we do a little bit what we call palliative care, which is very similar to what hospice care is. Essentially, it's focusing on palliation, trying to keep people comfortable. So I'm not one of your treating doctors, and that's why you've not seen me before. But from my review of your records, I know that you've had an abnormal heart condition called atrial fibrillation, and I know that you've had a pacemaker put in before. And when I looked at your CAT scan, your CT scan result from 2017, it mentioned that you had pretty bad emphysema at that time, and you had what we call bulla, which are like little out pouches of the lung, or so that tells me that you have bad emphysema at baseline. And
Well, I
when you,
didn't know I had.
that's based on the CAT scan. So I don't know what conversations you've had with folks before, and I think when you had passed out at home before you came in. Is that correct?
Yeah.
And there may have been a seizure. Is that what the thinking is?
I don't remember that much after that.
All right. So what the thinking was that you may have choked on something, what we call aspiration.
No,
And-
because I know I was walking with a walker, and when my blood pressure gets down too low,
You pass out.
I pass out. I
Right.
realize that.
Right.
So I'm pretty cautious about it.
Right. So what happens is if you aspirate, then stuff from the stomach can go in the lung, and when that happens, there's acidity in the stomach, and there are other things in the stomach, and if all of that goes in the lung, it can irritate the lung and cause inflammation and sometimes an infection. And my understanding of reviewing your records is that so far, all the cultures that you've had on the bronchoscopy have been negative, meaning they didn't find evidence of an infection. But that's not unusual, because often the damage that happens to the lung after aspiration is related to acid, and more like an acid burn, and rather than an infection. But all of it looks similar on a chest x-ray. And regardless of how it looks like on a chest x-ray, but what I can see on your chest x-ray is that you've got sort of white fluffy things on both sides of the lung that looks like scarring.
Yeah.
You are requiring a lot of oxygen now just to keep your oxygen at a reasonable level.
Yeah.
And were you taking oxygen at home before you came in? Were you on oxygen at all?
No, as I say, normally I would get up, and if my blood was a little bit low, I go over and sit in the chair. I've got one of those home things you carry around,
There's 3 liters.
and turn it on too, and it only takes me about 5 or 10 minutes. I'm back up and ready to go.
So you just wear it off and on as needed, essentially?
Yeah. That battery lasts for about 5.5 hours, and I carry 2 with me just in case. But
So you know, when you have some when you have COPD at baseline,
yeah,
which is low diagnosis and you're on oxygen, and then you get an additional insult on top of that, which is I suspect,
yeah,
chemical gas injury to the lung, then of course everything gets a lot worse. And the
For sure.
Go ahead.
That morning, I don't know, I must not have been realizing it, because usually if my blood pressure starts going down, I feel it. I know what's going on.
And you're able to sit down or do something to prevent you from
Yeah.
falling. Is that right?
It snuck up on me.
It did snuck up on you. But I think the concern of the lung doctors is that, you know, here you are, normally requiring oxygen intermittently, normally having an abnormal lung with COPD, and on
Yeah.
top of that, you've got all this additional damage on top of it now. And you're requiring something like 60% oxygen to try and keep your oxygen up.
I don't know what I need.
And so sometimes after an injury like this, the lung can improve some. Sometimes it doesn't improve, and ultimately you sound like